Good day, everyone. For this lecture, we will be discussing about attention deficit hyperactivity disorder or ADHD. So what is ADHD? It is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. Individuals with ADHD have difficulty in focusing their attention in ways that enable them to adapt in optimal ways to their environment. Based on the given definition, we can identify the primary symptoms of ADHD. First, we have inattention. It manifests behaviorally in ADHD as wandering off, difficulty keeping focus, and being disorganized, and is not due to the lack of comprehension. Next, we have hyperactivity. It refers to excessive motor activity and talkativeness when it is not appropriate. And finally, we have impulsivity. It refers to the hasty actions that occur in the moment without thinking about it beforehand that may potentially cause harm. There is no exact known cause of ADHD, but over the years, there has been some researches and findings have suggested the following. First, we have genetics. It suggests that ADHD is hereditary. So if a parent has ADHD, a child has more than a 50% chance of having it as well. Another is low birth weight. Specifically, the child needs to weigh less than 1,500 grams when he or she is born. Next, we have cigarette, alcohol, and drug use during pregnancy, brain injuries from child abuse and neglect in the uterus, and lastly, we have exposure to environmental toxins such as lead and infections such as encephalitis while being in the womb. According to the ADHD Society of the Philippines, 3 to 5% of the world population has ADHD. Some statistics have shown some data that 80% of adolescents have the symptoms, 60% of adults actually show the symptoms, 40 to 50% of children with ADHD have learning disabilities, and 30 to 50% of children with ADHD engage in disorderly conduct and exhibit signs of antisocial behavior. In the general population, ADHD is more frequent in males than females, with a ratio of approximately 2:1 in children and 16:1 in adults.
Good day everyone, I am Kinania Maridanyot and I will be talking about the different types of ADHD. So generally, there are three of them. The first type is the combined type. It's a combined type if symptoms of both inattention and hyperactivity impulsivity are met for the past 6 months. Next is the predominantly inattentive type. This is diagnosed when symptoms of inattention are met, but symptoms of hyperactivity, impulsivity are not met for the past 6 months. So we'll be talking about the signs and symptoms in a bit. And the last type is the predominantly hyperactive impulsive type. This is when symptoms of hyperactivity, impulsivity are met, but symptoms of inattention are not met for the past 6 months. And then we have here the signs and symptoms. Typically, ADHD symptoms arise in early childhood. According to the DSM-5, several symptoms are required to be present before the age of 12. So many parents report excessive motor activity during toddler years, but actually ADHD symptoms can be hard to distinguish from the impulsivity, inattentiveness, and active behavior that is typical for kids under the age of 4. These are the signs and symptoms for inattention or for the predominantly inattentive type of ADHD. So children diagnosed with this is often easily distracted by irrelevant stimuli. So naturally, they would also have difficulty sustaining attention on tasks or play activities, and they also not seem to listen when spoken to directly. Oftentimes, people with ADHD also fail to give close attention to details, or they make careless mistakes at work, and they also does not follow through instructions and fails to finish their work. Moreover, they also have difficulty organizing tasks and activities, and they dislike tasks that require sustained mental effort. Also, people with ADHD often loses things necessary for tasks and they're often forgetful in daily activities as well. Moving on to the other type, which is the predominantly hyperactive impulsive type of ADHD. These are the signs and symptoms. So persons with this type of ADHD often fidgets or taps hands or feet or squirms in seat. They also often leaves their seat in situations that requires to be seated. They love to run or climb in situations where it is not appropriate. They're also quite loud as they're often unable to play or take part in activities quietly. They may also talk excessively, and besides that, they often have trouble waiting for their turn. Thus, they often blurt out an answer before a question has been completed and also interrupts others like in games or conversations. So basically, oftentimes, they are always on the go, acting as if they are driven by a motor. Someone may be diagnosed with the combined type of ADHD if he or she meets the criteria for both inattention and hyperactive impulsive ADHD signs and symptoms. Note that these symptoms can change over time, so children may fit different types as they get older. As ADHD symptoms affect each person to varying degrees, the DSM-5 now requires professionals diagnosing ADHD to include the severity of the disorder. How severe the disorder is can change with the presentation during a person's lifetime. Clinician can designate the severity of ADHD as mild, moderate, or severe under the criteria in the DSM-5. For mild, few symptoms beyond the required number for diagnosis are present, and symptoms result in minor impairment in social, school, or work settings. For moderate, symptoms of functional impairment between mild and severe are present. And for severe, many symptoms are present beyond the number needed to make a diagnosis. Several symptoms are particularly severe, or symptoms result in marked impairment in social, school, or work settings. As individuals age, their symptoms may lessen, change, or take different forms. Adults who retain some of the symptoms of childhood ADHD, but not all, can be diagnosed as having ADHD in partial remission. For the pathomechanics, the exact pathomechanics of ADHD is not clear, but even so, several mechanisms have been proposed as factors associated with the condition. These include abnormalities like functioning of neurotransmitters, brain structure, and cognitive function. Due to the efficacy of medications, such as psychostimulants in the treatment of ADHD, neurotransmitters like dopamine have been noted. Depressed dopamine activity has been seen associated with this condition and has been identified in affected individuals. Through MRI or magnetic resonance imaging, some research has shown that children with ADHD tend to have altered activation of brain structure areas when performing certain tasks. These include the frontal and prefrontal regions of the brain, as well as possible the parietal lobe and the cerebellum. The formations of the basal ganglia nuclei in children with ADHD may also be involved. This theory may be supported by the efficacy of stimulant drugs in treating ADHD, which may also help to reduce deformations. Additionally, some research has shown that children who are more hyperactive or impulsive have a slower rate of cortical thinning in the brain, which is most evident in the prefrontal regions of the brain. This is a characteristic of ADHD throughout adolescence. Cognitive function is compromised as well and can be manifested through the various symptoms of the condition. As for the course and prognosis, in preschool, the main manifestation is hyperactivity. Inattention becomes more prominent during elementary school age, and during adolescence, the condition may be stable, but some individuals may have a worsened course with the development of antisocial behaviors. Signs of motoric hyperactivity are less common and may be confined to fidgetness or an inner feeling of restlessness. Also, impatience, inattention, poor planning, and impulsivity persist as well. In adulthood, along with attention and restlessness, impulsivity may remain problematic even when hyperactivity has diminished. A substantial portion of children with ADHD remain relatively impaired in adulthood. ADHD is associated with reduced school performance, attainment, attendance, higher probability of unemployment, and interpersonal conflict. Having said that, ADHD really affects the person's overall well being and may disrupt almost all areas in their life. So, I guess that's it for me now. I'm gonna hand you guys over to my savvy groupmate, Jade. Thank you.
Hi everyone, this is Jade, and I'll be taking over for the next few slides. Who are the members of the ADHD management team? First, we have the pediatricians. They are the ones who diagnose ADHD in children and prescribe treatment. Pediatricians are the ones who refer the family to an occupational therapist. Nurses aid the family by educating them about psychosocial interventions. Psychologists may also diagnose the child with ADHD and provide behavioral intervention or refer the family to an occupational therapist. Speech language pathologists, or SLPs, observe and evaluate the child's communication skills, such as articulation, fluency, and speech. SLPs also assess the child's social skills. Occupational therapists carry out behavioral therapy and help children develop coping skills and develop skills useful in everyday life. SLPs and OTs work together to develop goals and create an individualized treatment plan. Special education teachers, or SPED teachers, provide feedback to clinicians and parents about a treatment's success or failure. They also administer behavioral therapy in the classroom setting. Lastly, we have the parents. Parents are very important in the management of ADHD. They are in charge of creating a positive and nurturing environment at home, as well as practicing therapy activities and achieving communicative goals in their home. Here are some ways to manage ADHD. We have behavioral therapy, classroom management interventions, medication, and parent skills training or family therapy. I'll get more into it in the next few slides. First, we have behavioral therapy. So, behavioral therapy aids in the changing and monitoring of behavior. It helps a patient to complete and organize tasks. It helps a patient to work through difficult emotional situations. And it teaches the patient mindfulness and meditative techniques to control impulsivity. And now we have a few types of behavioral therapy. There is cognitive behavioral therapy, system desensitization, and aversion therapy. Cognitive behavioral therapy is centered around how someone's thoughts and beliefs influence their actions and moods. System desensitization teaches patients to replace a fear response to a phobia with relaxation techniques such as breathing techniques. Aversion therapy works by teaching patients to associate a stimulus that is desirable but unhealthy with an extremely unpleasant stimulus. So, an example of aversion therapy could be thinking about the bad effects of smoking while you are trying to quit smoking so that it will become less appealing to you. And these types of therapies are usually administered by psychologists and occupational therapists. Next, we have medication. ADHD medication is to be prescribed to patients whose symptoms are moderate to severe and unresponsive to behavioral therapy. There are two types, stimulants and non-stimulants. Stimulants increase neurotransmitters in the brain, such as dopamine and norepinephrine, which are linked with attention. Stimulant medications are considered safe, but side effects may include decreased appetite, sleep problems, tics, personality change, anxiety and irritability, stomach aches and headaches, and others. So, non stimulants improve attention, focus, and impulsivity. And examples of non stimulant medications include antidepressants. This is usually prescribed by a clinician. Classroom management interventions can improve behavior at school and interactions with peers. Education specialists and SPED teachers can change the classroom environment and make it more friendly towards children with ADHD by simplifying tasks, giving more time for task completion, having a good reward system, and sticking to a schedule. Next, we have parent skills training and family therapy. This teaches family members the skills needed to encourage and reward positive behaviors in their children. This includes managing disruptive behaviors, encouraging behavior change, improving interactions, and redirecting discouraged behaviors. Parents are taught to give immediate and positive feedback for behaviors they want to encourage and redirect discouraged behaviors. And now we have some management practices, which include keeping a routine, making lists and schedules, assigning special places for specific items, setting clear and consistent rules, doing task analysis or analyzing a task and breaking it down into smaller, more manageable steps, and rewarding good behavior. These are important because children with ADHD, especially the predominantly inattentive types, will find it hard to focus and frequently be disorganized. Keeping a routine and making lists, schedules, and reminders will help to make sure that tasks will be worked on. Breaking down larger tasks into much smaller ones will also aid in task completion. Rewarding good behavior is also important for letting the child learn what behaviors are acceptable or not. And here are some medical precautions regarding speech language therapy. We should be careful of destructive and harmful behavior. SLPs should take precautions when dealing with patients with ADHD accompanied by co occurring disorders such as autism, conduct disorder, oppositional defiant disorder, and Tourette syndrome. ADHD accompanied by autism means the child may be highly sensitive to some sounds, light, touch, smells, tastes, and pain. The SLP must communicate with the rest of the child's management team and parents to know about the child's sensitivities. Caution should also be taken when dealing with patients with ADHD and co occurring Tourette's because vocal and motor tics are spontaneous and uncontrollable. The child may harm him or herself trying to control the tic. ADHD accompanied with conduct disorder or CD may manifest in a child through behaviors such as hitting, biting, and fighting. Children with ADHD accompanied by CD should be treated in one on one sessions until the destructive behavior is addressed. It is also important that the SLP and the rest of the management team come up with a therapy plan to address this destructive behavior. A child diagnosed with ADHD accompanied with oppositional defiant disorder or ODD may have symptoms such as losing temper, arguing with adults, refusing to follow rules, blaming others for their mistakes, and excessive anger and vindictiveness. The SLP must learn to redirect the patient's anger and learn mood management strategies. So now you may be wondering, what kind of support is available for families and persons with ADHD? The ADHD Society of the Philippines is a parent-based organization that gives support to persons with ADHD and their families. They offer services such as parent support groups, adult support groups, and parent training classes. They also have SPED teachers who host teacher trainings and awareness seminars through their ADHD School Caravan program. You can read more about them in their website. So here's a bit of a trivia. According to Proclamation number 472, there is a National Attention Deficit Hyperactivity Disorder Week celebrated every third week of October.
Children with ADHD may show a core deficit in behavioral inhibition, which in turn leads to impairments in working memory, self-regulation, internalization of speech, and reconstitution. They are more likely to have language processing difficulties than a simple language delay. These difficulties are evident as a child progresses through school. In particular, the ADHD child with language problems can have auditory processing difficulties, such as short-term auditory memory weakness, problems following instructions, slow speed of processing written and spoken language, difficulties listening in distracting environments, for example, the classroom, and problems getting information from reading or listening. They can also have language difficulties related to their impulsivity and poor organizational skills, resulting in problems with classroom discourse, poor writing skills, word finding problems, and social language problems. As speech-language pathologists, it is our duty to address these speech, language, and hearing needs. We coordinate with members of the management team to create appropriate intervention programs. For more information on ADHD, you may refer to our list of sources that is on the screen. This list can also be found in our written report that is up in the Google Drive as well. And we're done! We hope that you have learned a lot in this discussion. Thank you!